45. Patients with early-stage breast cancer could be offered what's been described as a more convenient type of radiotherapy on the NHS if draft guidelines go ahead.
Experts say that the new treatment could be carried out during surgery, which would remove the need for weeks of radiotherapy.
Professor Jayant Waidya is on the line now for us now, has been involved in the clinical trials and is our London studio for us this morning. Thank you very much, Professor, for your time this morning. I wonder if you could just explain in layman's terms exactly what this treatment will do and how it works in practice.
Right, yes, we have been involved in this treatment. We developed it 14 years ago in UCL with Professor Michael Baum and Professor Jeffrey Tobias and myself. The treatment is done during lumpectomy, that is the surgical removal of the lump in the breast, which is the breast cancer. And while immediately after lumpectomy, a radiotherapy probe is inserted into the breast and radiation is given from within the breast to the tissues immediately surrounding what was the tumor. And these are the tissues where the risk of recurrence is the highest, and that gets the best treatment at the right time, at the right place. And it is the immediacy and the accuracy of the treatment that probably makes it efficient. And what we did was we treated 3,500 patients in a randomized trial in which half the patient got this treatment and half the patient got the standard treatment. And what we found is that when you give it at the time of lumpectomy, the effectiveness is similar. The difference between the two treatments was not statistically significant. So therefore, in terms of breast cancer control, we found that it is as effective. And in terms of other causes of the deaths from other causes, there were fewer deaths in with target treatment, which is targeted intraoperative radiotherapy. That's what we call the procedure. So for a woman with breast cancer,
yes, I was just going to ask. It's in the trial stages at the moment. You've got the results of the trial. So how far away from being used routinely for most people?
It has been used in over 8,000 women around the world. So now we have the results of this trial, which has been going on for 12 years, and they were published in February, and we now know that it works. So therefore, it is now suitable to be used for selected patients with breast cancer. So we think now we have good enough results for it to be rolled out into clinical practice, and this is reflected in the draft NICE guidelines.
So in a practical sense, those people who are suffering at the moment, they will have to have a conversation with their specialists, with their GPs about the treatment? Is it something they can request or look at and just talk through with the medical professionals who are looking after them?
Yes, indeed. They can start requesting this now. It will take some time for it to be rolled out in the NHS for each center to be equipped with this technology, but it shouldn't take too long. Germany already has 60 centers with the machine. Around the world, there are 200 centers with the machine. We have about 9 in the UK, but